Hi everyone, my name's Roisin Malloy. I'm the CEO and co-founder of Trimedica. We're a medical device manufacturer based in Belfast. And we manufacture a clinical grade non-contact thermometer like this. So you basically point at the forehead and you get the result. So we're here today to talk to a very interesting person, Gary Boyle, and who reached out to us recently regarding a recent experience in hospital. At Trimedica, we develop devices with the patient in mind to ensure that patient comfort is a priority in considering both the technology and the design. So Gary, can I maybe just ask you to introduce yourself, please?
Certainly, yeah. My name is Gary Boyle. I'm living in Dublin, in Ireland. I'm from Carlow, in Ireland. I've been, Roisin and myself met by chance, really, through, we both kind of similar interests, but Roisin is doing a great job with Trimedica, and I'm trying to do a good job by being a patient advocate and trying to get things done. And it was in that vein that, in the last 6 months or so, I had some surgery and will improve the lot, if you like, of the life of people who are in hospital or who are going into hospital or who have been. That all these experiences can be brought together to give one overall big improvement to everybody who is in hospital or who has to be there.
Well, Gary, you had a recent stay in hospital. I think you were in for 10 days. Do you want to just give us an understanding of your experience during that stay in hospital and an indication really of from an everyday perspective of those 10 days, what was it that, really impacted your experience and also your time in the hospital?
Sure, yeah, I'll try and cut me off when it starts getting very long-winded and boring and stuff like that. But I was there, yeah. It was just at the start of the year. I had to have a sciatic nerve that was kind of had pinned onto one of my vertebrae, and I was in extreme pain. I was very fortunate. I went to hospital. I got the pain treated. The both the vertebrae and the nerve ending were released and removed, and thank God they'll never get together again because if they do, I'm in serious trouble. But anyway, and that was great. But I have to say, and I have to say, in hospital and stuff like that, things are really good. I mean, there are people there who care for you and who want to care for you and want to do a good job. But there's also a kind of a method of doing things that doesn't always fit for everybody. And one brief example I'll give you is I'm actually living with Parkinson's disease. I've been living with Parkinson's disease now for about 15 or 16 years. And one of the key things for me is, and for all people living with Parkinson's, is we need to take our medication. We take a lot of medication and we need to take it at the very same time every day. So my first experience of that was at 7 o'clock the first morning. I was in the hospital where this person came over to me and said, "I need to give you your meds now for your condition." And I said, "Well, you can just leave them there because I'll take care of them." "No, no, no, I have to give them to you now, and you need to take them, and we'll come back at 7 o'clock tonight." I said, "I'm sorry, that doesn't work that way. I'm a person living with Parkinson's. I have to take my medication at the right time, every time, same way every day." That's what the tagline that I just made up so that people could understand where I was coming from. And it was a bit of a battle, but I thankfully won out because it couldn't work any other way. So I mean, there was that, and then there was one thing I noticed, and it kind of shocked me a little bit. At certain times, well, actually, you know what? Every time a kind of a health professional came into the ward it was in, or whatever ward people were in, and the first thing they do is go to take the temperature of the person, which is totally right and understandable and stuff like that. But it was a kind of a device that had a plastic cover on the top, and you kind of put the two things together, and you placed it up against the patient's. You trying to put it in their mouth or put it on touch their skin or put it under their arm or wherever you put these things. And the person usually, if they were asleep, usually woke up, which was unfortunate. And the other thing was there was the because of health and hygiene and stuff like that, the top would come off when the reading was done, and you'd throw that away, you know. So kind of while it was kind of landing there on the floor, right. But it was just a case of I was kind of I was looking at what was going on. I was thinking, what's happening here? Why are people being woken up, have their temperature taken, and why is this big thing being stuck into their ear or stuck somewhere else to get a reading that like takes like a nanosecond? And it really struck me that that's really old. I mean, that's what they used to do, surely, but apparently not. That's what we still do, and that's what a lot of organizations still do. Now I know, and Roshi and myself know from research that's been done by the groups we work with, the people we work with, ourselves, stuff like that. We know that there are devices out there that can make life easier. We know that there are devices out there that are not archaic and are not anti technology, and we can use them and they can do a really good job. I just was shocked to think that, like in one case, um, one of the healthcare professionals was telling me that there's a little child in one of the wards that she has to take a temperature of every, I don't know, 3 or 4 hours or whatever. The device is nearly bigger than the baby. You know, it's kind of it just doesn't fit right. It doesn't sit right, and it doesn't make any sense. And then when you see what's on offer in terms of what's available, you think, what are we doing with this? You know, this big thing here and this little thing here. I mean, it's a no-brainer. You know, the little thing wins out because guess what? You don't have to touch any part of the body. You just hold it up to the person's head or the person's whatever you get access to, and you can come in discreetly, take the temperature, and off you go. And as you're off you go in that space, lots of things are happening in technology. You know, there's a that piece of data has been sent to here, which is going over to here, and all these files have been updated, and everything is regular, and that's what technology does. So, I mean, that's kind of that's why it'll blow your mind when you see what's going on in the space of this is so not technological what we're doing at the moment. I mean, why would we wake somebody to take their temperature and then have to probably give them a sleeping tablet to get them back to sleep? And like, think about that. I mean, the implications of that are just mind-numbing, you know. And I wasn't there for any mind-numbing reasons. I was there to get in and get out as quickly as I could. But it's just, I was taken aback by this, and I thought that we could do a better job because we can do a better job, and it doesn't require rocket science. It's there, and I think it would make a huge difference if we just kind of scrapped what we're doing at the moment and went straight to press play, go straight to go, and use the tools and equipment that are already fully, um, what can you say, fully technological, and they can be used ready, as they're ready now, and away we go. And let's make one aspect at least of the hospital say even better, and I think that's what we should be looking at.
So Gary, this is really, and the purpose of this video at the minute is to look at a patient's perspective and how does that patient in the bed being looked after by healthcare professionals, how are they impacted by this sort of non-uptake of technology? So how, from a patient's perspective and just in that bed, obviously not feeling the best because you wouldn't be there if you were. But how does that impact sort of your sort of state of mind, also your sort of long-term impact of recovery and so on from your perspective?
Yeah, I mean, like it's kind of you could let yourself get frustrated and say, you know, this is madness and stuff like this, and kind of in many ways it is madness. But you know, the definition of madness is doing the same thing over and over again, expecting a different result. We're not going to get a different result if we can continue to do the madness with the simplest little things that are just begging to be changed, you know. Lying there in bed every day, you're kind of thinking, I want to go home. And how do I get home fast? You know, that's the main thought you have. But then, excuse me, you just mentioned a bunch of people there that have nobody's advocate for themselves. People who are long term in hospital. This is a really serious thing. They're long term in hospital. I mean, that's a kind of a phrase that we should be trying to eliminate as much as possible. being long term in hospital is not the future. It absolutely is not the future. Being long term in hospital is, kind of a flag that says you need to do it now. You need to change this now. It's not working and it has to be changed. And the biggest thing I'm talking about change is advocating for the person who has nobody to advocate for them because they're long term in hospitals or whatever, or the national health system in Britain, or the HSE here in Ireland. We're talking about really, really good professionals, people with a decent heart and a decent brain who want to do the right thing and who can do the right thing if they're permitted to do it. But if we have these antiquated tools coming down the trolley to kind of help people, that ain't going to be any future for anybody, in my humble opinion. And I think we could, we can do a lot better than that. And I would just say that, we need to be open minded, not totally free for all or anything like that, or the madness will continue. And I'm really, I'm not that clever. So I mean, if I can see, so I can see what's going on. I shouldn't laugh. I'm only laughing at the circumstance of it. I'm not laughing at the actuality of it. The actuality of it is really sad because I was there in the hospital for about, they got to 2 weeks. There were people who were in hospital before I got there, had been there like 2 or 3 months, and we're facing the kind of the likelihood of being in hospital for a further 3 or 4 months after I left.
Yeah.
I mean,
Gary, that's actually I need to say that, about other people's perspectives. So what we do a lot of is we would talk to a lot of the nurses and doctors who are the healthcare professionals on the other side of the bed, taking those temperatures and looking after patients. And they get what we've heard is a considerable amount of frustration in why can't we get the better tools and why can't we make this easier? We're always in the news at the minute, we see a lot of, nurses under a lot of pressure, doctors under pressure. They haven't enough time and so on. Yet devices where technology can really change the game, devices can really give them back some time. And not just even from a time perspective, but also from their ability to offer better healthcare for the patient and more empathetic healthcare for the patient. One piece of feedback as well as with our thermometers because they are non-contact. They don't touch the patient, so not only does that protect the patient from infection risk, it also protects the healthcare professionals from infection risk too. And we saw a lot of that during COVID, where they were under huge pressure, mentally and emotionally and physically, I suppose, that for infection rates and so on. So we have seen also recently a press release released, which was called, it was entitled Putting the Patient First, a call for a more humane approach in hospital care. It was published in March this year. Yet we continue to do the things, as you say, that we've always done. So how do you think the organizations or the healthcare systems can adopt this process of implementation, get the patients involved and put in devices? And of course, we all know that these devices have to go through all the rigor of the regulatory, which is very important. But how could you see, or what way would you propose they could do this?
if collectively we could together acknowledge what we have, but that we're not using, and make that break, make that seismic decision to go with what's working elsewhere. Because I think you mentioned to me earlier, Roisin, that there are places that are using the newer devices, if you like, and the feedback that is kind of emanating from those locations is that yeah, these things are actually very good, and it doesn't appear to be. I don't think it's necessarily a money or resource thing because every health professional I've met, between staying in hospital and kind of follow up and stuff like that, wants to do the right thing. There's no question about that. Every single healthcare professional in the UK, in Ireland, they're decent human beings. They want to do what's right, and so we have the attitude, we have the building block of technology itself. What we need now is the implementation. And you know, you mentioned about reviews and stuff like that. Yeah, but like, I mean, how many more reviews do we have to do? Like, there's a crazy system in the European pharmacy union health thing, whatever it is. Like every country brings forward its kind of breakthrough, every country is assessed on its own merits, and then it's brought into the wider European kind of stage. And guess what? I have to go through the whole rigmarole again. That is not use of technology. That is not the use of the goodwill of the healthcare professional who's only dying to do stuff to make life better for others. There's a number of things we could change in both the medium term and long term. I don't particularly want to go down that road right now because we'll be here forever, but I'd happily do it if you want to. But it's just a case of we can do a better job. I'm really concerned about the people who are long term in hospital, and long term seems to be anything over kind of a couple of months. Like, what are they going to do? What have they to hope for? We just need to have discipline in the system that closes it off and moves along to the next phase. So it's really actually, I think it's a revolution waiting to happen, because it's so easy. It couldn't be any simpler, and I think I hope that's what we discover when we hopefully go to implementation very soon.
Yeah. No, I think it's very important. One thing you said there, Gary, was that we need to advocate for patients who don't have a say. And one of the areas of the hospital that with the tri-temp thermometer for the technology that we get a lot of interest and uptake and use is in the pediatric and the neonatal wards. So these are children and very, very young babies, preterm babies who don't have a say for themselves. And parents can get involved, and parents like to use devices that don't disturb their babies and so on. So we've had feedback even from parents to say, oh, this is so much better because the baby doesn't have to be wakened and so on. So, it is important that we are developing devices with the patient in mind and the application in mind to ensure that those individuals are looked after to the best of our ability, really, and that we can move that forward. So just in that note then, Gary, with temperature measurement at the time in hospital, I think one of the things everyone thinks temperature measurement it's just taking a temperature. It's so easy and quick. If you multiply that by 4 times, 10 times, whatever a day, and things being shoved in your ears or mouth or where they're taking the temperature, this can be very off-putting for the patient and also very, very disruptive, especially if they are in pain to start with, but also
Yeah.
mentally and other ways.
Yeah.
So with that in mind, then how is there something fundamental that we can do moving forward, from a patient having their say or having some sort of forums or some input from patients to have that built in really to the technology?
Yeah. I mean, maybe the forum is the way forward, that people, a regular forum every month or 6 weeks or something like that, to review what has changed in the last 6 months, 6 weeks or whatever length of time. And it could be there that you find out that, oh, they're using that thermometer thing that I heard about. How are they doing? And you just kind of have a quick chat and find out. And, you can find out somebody else is using a blood pressure monitor. I don't know all these medical things, I'm just an ordinary person, so I could say something that refers to a car. It makes the same difference. But
But you're a very important person, Gary. You're a patient, and the patient is the important person in all of this, so
yeah,
it's
I think, yeah, it's true. Because the patient is kind of at the front line of everything.
yeah.
I mean, every service that comes in to be delivered to that patient is going to be really good, but it's another service in kind of a whole load of services that are coming down the line for that one person. So that one person is going to receive a huge amount of kind of attention and direction and instruction and all that kind of stuff, and you have to put it all in here. And the healthcare profession they're dealing with it say, great, right, we'll move on, see you next time, and all that kind of stuff. And that's exactly the way it is, and it's probably exactly the way it should be. You just need to remember that that patient is taking in a stack of information themselves and is giving feedback based on what they see. And I think that's only fair because they are the ones that are going through the treatment for whatever reason it may be. And we, well, I can't say I'm not a healthcare professional, but healthcare professionals know what they're talking about. There's just a little bit of listening needs to be done because that's the kind of the crucial piece of the last kind of bit before the button of implementation is pressed, and the magic of technology happens. You know.
Yeah. Um, and moving forward then, Gary, I mean, you mentioned about sort of implementation and patient's voice. There is a system in the US, and they actually have something very similar to that, and and of course the US is a different health system. A lot of it's privately, it's private healthcare and so on. But the hospitals there do have a method for getting feedback from every patient that stays in the hospital. And then they put this into a database to basically look at what is impacting patients and what the patients think could be done better. So this is something certainly that, from my experience of being in hospitals and so on, would be really good to introduce, especially when it is a health service situation where efficiencies and so on for the health service, both budgetary, both sustainability issues, infection control issues, and so on, which can be controlled much better by using better technology, could have a significant impact. And I think it's back to your point, Gary, of if you keep doing the same thing, then you're going to keep getting the same results. So moving forward, do you think technology can change patients' lives? And what if you had the head of one of the national health services in front of you, what would you be asking them to do today, tomorrow, that could actually have that impact?
Well, to answer your first question about do I think technology can help? Yes, it can. It's as simple as that. It's waiting to it's waiting for the button to be pressed and for it to be implemented. And the people who are behind this are, the leaders of their respective fields right around the world. So, I mean, there's no need to argue. There's no need to kind of put any more calories into vetting what these people are doing. They've been vetted, and it's really really important. I think that we move on that very quickly. If I was talking to the head of the various different organizations that are responsible for health, first thing I'd be saying to them is good luck. You know, it's a tough job. It's a tough job. But when you start to peel it back a little bit, and I have to be careful what I say here, when you start to peel it back a little bit, the hardness or the toughness of the reality of working in healthcare, where on the one hand you have all this technology, you're thinking, bloody hell, it's going to be amazing with this stuff that's implemented. And then on the other hand, we're not doing that. Very hard to kind of put those two things together and make something that makes sense. But that's what it's going to require risk taking that we've never seen before, um, but risk taking that we've actually done every day of our lives without realizing it. There is no way we would be chancing anything, taking a chance on something if we thought it was going to affect a patient's life. There's no way anybody in the health service would do that. But they are actually, every day they make a decision on what kind of drug to prescribe or what treatment to kind of put the person on the waiting list for, or what kind of, discharge them from this hospital and move them to the other. They're making those decisions all the time. I just think we need to make the decisions with a little bit more clarity on what we're actually saying we're going to do, and how that clarity can bring kind of peace of mind primarily to the patient, because that's the person who's receiving all this, but also to the people who are maintaining the health service and who are providing the fantastic support and service that they provide. I mean, we need to give them reassurance and support as well, and help them understand that what they're doing is brilliant stuff. I mean, like Roisin, what you're doing is incredible. It's putting the lives of patients first. It's putting people first who need help and who need to be looked after. And you're doing it every day. You don't even think about it. You're doing it every day, and it happens. But like when you look across the whole stack of the multidisciplinary approach for patients, not every patient needs every kind of treatment that exists. But all these patients here need all these people here, and putting them together like that is so important, and that's where it makes a difference. So if you can do anything you collectively, all of us, if we can do anything that makes that service work smoother, more efficiently, more effectively, why wouldn't we do
Yeah, yeah, no, 100%, Gary. So, Gary, I just want to thank you very much for taking the time today to give a patient's perspective on the need for better technology for our hospitals, and to see it from the patient's point of view, because better technology, more comfortable patients, and more rested patients, as you say, generally leads to better patient outcomes and therefore better healthcare solutions. So
it?
thanks very much, Gary, for your input.